aspect of the healthcare workforce, but certainly in the nursing area, and one that we have to figure out how do we balance that shortage with providing great quality care and safe care, and figure out how do we fill the gaps in staffing that occur in a way that can help us get out, keep people in the community. The trend nationally and here is to, wherever possible, to help people live in their own homes or at least in the community setting, and not in an institutional setting which can make them perhaps more dependent on the level of care than they need, and certainly isn't what most people want. They really want to be in the comfort of their home or with their families, and that tends to help them either recover if that's the case, or to continue to be managed better and have better quality care in the process if they are in a home setting. So we think that this might be the right direction to go. Certainly the evidence suggests that it is. And that if we look at what home health aides can do, we obviously need to have the proper training in order for that authority to be delegated. And they need to be working closely with the nurse that has had perhaps more training. But we think it's a way to kind of stretch the professional availability in a way that does not stretch the limits of patient safety. Very critical aspect of it. I've since becoming involved in the health chair, as the health chair in 1999. One of my priorities has been patient safety, and I would not support something that I didn't think was moving in the right direction. It is not something to take away anybody's job. In fact, it is to enhance the jobs that are being done in the community by those folks who are going to do it. So it's very important that we strike the right balance. We think that our friends in New Jersey, a little bit further down the coast, have had some success with this, and we're going to hear about that this morning. To say that this is not, while it's a relatively new direction to go, it is not uncharted territory. And it is an area that other states have been able to move toward very successfully and continue to maintain quality care for their patients at a time when all of our states are struggling with how do we pay for all of this. And as the country will be rolling out more activities in the healthcare field. So we think it's the right direction to go, and I think what we hope to do this morning is to both hear about this. I would frankly say, as we move the bill forward, and those of you who are in the field and have experience with this, if you have ideas that you think we can improve the quality of the bill or how it might be implemented, we need to hear from you. So this is kind of an opportunity to give you the overview of what we're trying to accomplish, and give you the opportunity for feedback and to question those areas, for instance, our friends from New Jersey, as to how it's worked and whether there are any things they would change about what the process has been that we can learn from, so that we're not, traditionally reinventing the wheel in this sort of thing. We think it's a good direction to move, and I hope you will as well, as you have the opportunity, and that you will share with us your input, your advice as to how to make this better, if it can be made better, and perhaps guidance as to how we can. Passing a bill is one thing, implementing it successfully is another, and so we also want to know some of that, because ultimately there will be regulations promulgated on the implementation law. So the more we can learn about what needs to be done ahead of time, I think will help make a much smoother transition and won't result in cases that make us wonder whether we did the right thing in the first place. So I thank you for attending, and I thank our friends from New Jersey for sharing with us their expertise in this, that we can certainly learn a great deal. Thank you. Welcome.